Okay, we are live, and this is Bruno. Our podcast is LARVOL and Friends. Every week, we interview someone related to our business. LARVOL is a SaaS company that provides solutions for the pharmaceutical industry. We sell. There's a bit of background noise here. Can you hear me okay, Lynn?
Yes, I can hear you.
All right, that sounds good. Maybe our producer, Shahir Sheikh, who is keeping us organized. Shahir, there's a bit of background noise, I think, on the line. You might want to look at that. So we are providing various solutions for the pharmaceutical industry. And today we're going to talk with Linh Nguyen, who is a rock star with us, and we're going to talk about the field of key opinion leaders, or KOL, for the medical affair field and for in the pharmaceutical industry. So the first part is going to be an introduction. Then we're going to talk about the field of KOLs in general. And finally, infomercial part of the program, we're going to talk about one of our solutions in that field, which is called Omni. At the end, as we usually do, I'm going to ask our guest, Lynn, today to give us a takeaway on that topic. So welcome to the program, Lynn. Please give us a quick intro.
Thank you, Bruno. I'm excited to be here. My name is Linh Nguyen, as Bruno mentioned, and I'm a senior account executive at LARVOL. I most recently just celebrated my 5-year Tiger anniversary, which coincided with our 18-year anniversary. So that was a huge milestone for me. I've also had the pleasure of partnering with many different pharma companies and biotech companies to support their efforts, especially as it pertains to KOL identification, mapping, and monitoring. So I'm excited to share what I've learned when speaking with some of our customers and some of the trends that we're definitely starting to see emerge.
Thank you for the intro. And yesterday, we did have our anniversary. It was a lot of fun, and having you there and all of our colleagues was a lot of fun. So let's get started. Assume, Lynn, that I do not know anything about the field of key opinion leaders. Explain to me what a KOL is and why it matters for the pharmaceutical industry and the medical affair field.
Of course. So key opinion leader or KOL, and there's different variations. We see other customers of ours refer it to KEEs or even HCPs, healthcare professional practitioners. But essentially, a key opinion leader is a trusted, well-respected influencer with experience and expertise in a particular field. And in particular, in healthcare, these leaders tend to be physicians, hospital executives. We typically see even nurse practitioners, community physicians, anyone who's part of perhaps like a patient advocacy group member is really a trusted person that people within the pharmaceutical industry really look to for their professional advice or expertise.
I'm going to give you a bit of a biased question, but provocative on purpose. What's the difference between medical affairs and sales in the pharmaceutical industry?
That's a good question. So medical affairs, my understanding, is really more about educating HCPs with information as regards to new studies coming out of clinical trials and what they recommend to be, let's say, standard care of practice. Whereas with sales, and the two are pretty close, tied hand in hand, because of course with educating the team comes making sure that you're of course promoting your specific brand or drug. which I think this is where really the sales reps come into play. So they might not be able to specifically speak on a clinical trial, but they can, of course, provide information about the drug and recommend that this physician use it. So I think that they are very closely related, but I think with medical affairs, the spirit of it is definitely educating the physicians, especially on clinical trial data results and what the standard of care looks like.
And again, we are not we're not advising our listeners about what can and cannot be done. Obviously, if you're in medical affairs, if you're a field medical, as we say, an MSL, medical science liaison. But the one point that I want to add to that is very important is that when you're an MSL in the medical affairs field cannot promote, obviously. They cannot promote a drug. They have any comments they have is educational. Now, what exactly that means is a complex question. But the interaction with KOLs is precisely a communication that cannot be promotional. And this is extremely important from a compliance and legal standpoint. So often, that communication needs to be initiated, that request needs to be initiated by the physician, by the KOL, by the healthcare professional. And it needs to be balanced and unbiased. It cannot be, it has to be of scientific quality as opposed to with a commercial intent, really. And that allows medical affairs to talk about topics that a salesperson could not talk about, precisely off-label indication of a drug. Salespeople in a pharmaceutical company have to stay to the label, to the approved indication of that drug. But a lot of science, a lot of medicine has to do with new emerging evidences, new clinical trials, and yes, also new use of a given drug. So that falls under medical affairs. And so for pharmaceutical companies, identifying and tracking KOLs became an important topic. So let me shift to a related point, Lynn, which is in your interaction with your customers, with pharmaceutical companies, with mostly medical affairs professionals, what have you seen as the trends, the new development, the emerging topics over the last couple of years?
Great question, Bruno. I would say that in the last couple of years, there's definitely been an emergence in juggling, your traditional channels with digital efforts, especially with the COVID-19 pandemic. Of course, we saw a rise in digital opinion leaders who are key opinion leaders who are very active on social media, whether it pertains to Twitter, LinkedIn, Facebook. And recently, we've seen a lot of KOLs in the TikTok space as well, which I know that you're quite familiar in, Bruno. And we've gotten requests from several of our customers to even explore TikTok and Instagram to see how we can extract some information from these social media platforms to help them with their traditional channels. So we're seeing that true omni-channel engagement is something that is really valuable for a lot of our pharma customers, being able to create meaningful engagements with their KOLs through multiple different channels, as opposed to your traditional channels like clinical trials, publications, and really expanding that to digital efforts.
So the term omni-channel strategy, would it be fair to describe it as having a coordinated, consistent, integrated communication and engagement, perhaps also listening of key opinion leaders. Is that a fair definition as well, based on your understanding? Lynn, I think you might be on mute.
Oh, can you hear me?
Yes, I can hear you. Yes.
Perfect. No, I wanted to add to that and just say that the omni-channel approach really allows users to ensure that they're meeting, not users, wrong, to ensure that our pharma customers, of course, are ensuring that they're meeting the needs of their customers, their KOLs, with exactly where they are, with the right message and at the right time. So as you were mentioning, you want to be able to create like a unified experience that acknowledges all previous touch points along their whole customer journey.
We did not know that term. I don't think that emerged yet when we named our product Omni, and we're going to talk about our solution in a moment. But it's ironic that now it's actually called Omni-channel strategy, and our product name is Omni. Believe it or not, it's a coincidence. We did not plan it that way. So, by the way, I want to acknowledge again Shahir Sheikh, who is our producer for this podcast. And as per tradition, during the podcast, he jumps in at some point to ask a question or make a comment. So today, Shahir, we won't tell you when to jump in. Surprise us. Just jump in anytime you want and ask a question. So here's the other. You mentioned TikTok a second ago, and as you said, I'm a fan of TikTok. I think it's an incredible platform, but in my mind, I was not thinking about it as a channel for physicians and KOLs to talk about scientific data or to be active and so on. How much of a trend is it in your experience? Is that anecdotal, or is it really an important trend that is taking place now?
That's a good question. So for now, I would say it's still anecdotal. We've heard that requests come in from a few of our pharmaceutical company or customers, but I think it definitely is a new channel for some of the digital opinion leaders who are creating kind of educational videos. And it helps even combat misinformation. So I find that being able to engage with your key opinion leaders in new interactive platforms can help really set you apart from your competitors. And I know something even related to that was with the metaverse. And last year, we even put together a few ad boards in the metaverse where we invited some key opinion leaders, even some of our customers, to join us. And being part of that new immersive environment, new space, I think created a lot of opportunities, even for some of our existing customers with the key opinion leaders while there. So I think those who are able to adopt newer forms of social media or newer ways to interact with their key opinion leaders, I think we'll start to see a lot of success, because not everyone is involved within social media, let alone TikTok. So I think for those who can really differentiate themselves within those spaces, I think there's definitely going to be a lot of traction.
You're mentioning the metaverse. I want to spend a few minutes on this. So during COVID, engagement between pharmaceutical companies and KOL has changed a little bit, of course, because it shifted from a lot of in-person meetings to Zoom. Advisory board, tumor board, or just call moved to Zoom instead of being in person. And I think one of the things we heard from the marketplace is that the engagement, the presence, even the focus that people had in these interactions has been different from an in-person. It's people were distracted. People were maybe participating to an advisory committee on a certain topic, but not quite as engaged or immersed into the situation as when it was done in person. And now it's going to be interesting to see, now that we're getting out of this terrible COVID pandemic, whether or not in-person meetings between pharma and KOL are going to take the same place they had 3 years ago, or whether it's going to be very different. Meaning, a lot of KOL are going to say to pharma, well, let's just have a Zoom call. The challenge with that is that the quality of the interaction is not the same. And to your point, what we've seen at LARVOL is that the use of immersive technologies, virtual reality, the metaverse, has provided a way to have truly much more engagement in meetings with KOLs and even with pharma. So we had several pharmaceutical companies at the ASCO Cancer Conference a couple of months ago who came to us and said, can you help organize essentially metaverse meetings, virtual reality, immersive technology meetings with key opinion leaders? And the reason they were so excited about the idea, and we're actually doing pilots with them as we speak, is the expectation that the engagement with physicians will be much deeper and much with much more focus and intent and presence that way. Of course, there are still challenges, then, as you know, one of them being that physicians and KOLs often need a good amount of tech onboarding outside of their field of interest. Many of them, not all, many of them are actually not as tech savvy as you would expect. So the idea of putting a headset on, a virtual headset on, and joining a virtual tumor board, the technicalities of it and all the troubleshooting can be a challenge at times. So anything else on this topic? And then we'll move to talking about our own solution, which is called Omni. And you can describe it and tell us of the reaction that you got with your customers over the last few months, and even you've been involved with it for a couple of years now.
Yeah, no, nothing else to add in terms of the metaverse, but I think it's such an exciting space to be in, and to create, like you were saying, new immersive environments for interactions with your key opinion leaders in ad boards or tumor ad boards. I think that's just going to create a different level or type of engagement and really differentiate yourself from some of your competitors. But the next topic being Omni, I'm more than happy to speak on Omni. For those of you who don't know, Omni is our interactive web application which offers our users the ability to monitor any and all new developments related to their key opinion leaders in real time. And what's great about our interactive web application is that you would be able to see different channels where you can interact with your key opinion leaders. So we mentioned, of course, being able to track any of their social listening, so seeing their activity as it relates to Twitter, Facebook, LinkedIn. We're still trying to see how we can incorporate TikTok and Instagram into our algorithm, but across different forms of social media, even across YouTube, blog posts, interviews, we are capturing content to provide our customers with the ability to hopefully engage with their KOLs when they come across these new pieces of information. And then we also do, of course, include your traditional channels. So being able to include information on their publications, clinical trials, conference activity. One major area that we're able to track for our customers is upcoming events, really being able to provide our customers with grand rounds, symposiums, live and online CMEs, where they can meet and interact with their KOLs in person directly. And we find that Omni, there's really two customer groups that we have found utilizing Omni. One, I would say, is for new drug companies who are preparing for an upcoming launch, and they need to get a better understanding of who their key opinion leaders are within this space. Typically, they have an idea of, let's say, 5 to 10 top key opinion leaders, but they don't really have a good understanding of what the relationships are amongst these KOLs, even amongst these institutions. So, working with our team, we also do provide that KOL identification component. So being able to identify, let's say, community physicians as opposed to academic physicians, and that's something that we can take into consideration, making sure that we meet specific criteria or parameters that our customers provide us. Sometimes they'll provide us with even like keywords. So our team will be able to really hone in on who we think they should be following. And then once we've identified their key opinion leaders, in addition to having access to an online platform, they also get access to weekly reports that are delivered directly into their inbox. And it's a great way for you to stay on top of all of the upcoming news items or even the past news items from that week. And a lot of our customers like to refer to it as their like Monday morning newsletter or daily digest. And it's, as we know, in this day and age, there's so much information out there. And so being able to have this kind of spoon fed directly to our customers has saved them, so much time.
So there are two sides of utilization of a data platform like ours. One is pull, the other one is push. So pull is that when you go to the online platform, and push is that you receive that digest that you mentioned. Which of the two do you think is create the most value for our customers?
I would definitely say it's the push emails create a lot of value. And what's great about our push emails is that everything is hyperlinked to take you directly to the source. So you don't necessarily even have to go into the platform. If you take a look at your weekly email and you see something that really catches your eye directly from that, you can, of course, click onto it and see any additional information, or perhaps you want to sign up for a specific event. You can do that all within just a matter of clicks.
Our head of marketing is going to have a few chosen words for me, because I'm going to ask the following question: who are your competitors? She's going to say, "What do you mean you're promoting our competitors on your podcast?" But it's a question I'll always ask to any vendor when I interview a vendor, which is, who are you competing with? And I always find it helpful to hear that. So who are you competing with this product?
That's a good question. So, Bruno, do you actually want me to name competitors, or?
Yes, I do.
Yes. Okay.
They need all the help they can get, of course, right? So we might as well help them a little bit.
Okay, we can just help them just a bit. But what I will say is that our product is differentiated from a lot of our competitors because we don't just rely on automated technology to be able to deliver these insights or even gather some of these insights. We also do have a team of expert analysts who are working to ensure that the data that our customers see are accurate and relevant. So I would say that that definitely sets us apart from a lot of our competitors. So speaking of competitors, I would say that within this space, we typically will see other customers using Komodo, Monocle, H1 Insights, Lumineers. But I would say that our platform and reports can definitely be used in combination with any of these other supporting tools. I find that a lot of our competitors, they're great at having access to millions of HCPs within their platform. So, you could really search for anyone within their platform. Whereas with Omni, we don't necessarily we're not focused necessarily on the breadth of coverage we have for KOLs. You know, we really limit ourselves to the KOLs that you're mainly interested in. So we can track anyone, regardless of whether they're in our database. If they're not in our database, we can get them added. And we typically will profile a KOL for 6 months to a year to provide our customers with any previous history related to their KOL. And so we're less focused on having a database of KOLs, but we really get granular when it comes to your KOLs. We recognize that in order to maintain a database of 10 million HCPs, it would not be possible to ensure that every single data point that you see is accurate. And that's why we really pride ourselves on being able to research and focus on the KOLs that are the most interest to you, and making sure that we can capture any sort of information, whether it is through social media, publications, conferences, and ensure that it is accurate.
I'm ready to buy. I'm ready to buy. Lynn, thank you for the explanation. Shahir.
No, before you go ahead, I have one question.
Yes.
It's the producer itself, Shahir Sheikh. So, Lynn? A quick question from you. I really appreciate all your comments that you've made. But what is that one thing that you feel we might be able to add some value utilizing the adoption of metaverse itself, as you mentioned before? What's something that you feel, oh, if we adopt metaverse itself, we would be able to, create a boom in this aspect of the product?
That's a good question. And Bruno touched on it a bit, and we're currently exploring several different pilots where we could put together virtual ad boards and really create, like we were saying, that new immersive environment. And I think we're a little bit early still with the technology. I think there's still a lot to come in terms of making the headsets lighter and making sure that you can, of course, wear them for multiple hours within a day. But I think we're definitely headed in that direction. And I'm not sure necessarily what the future holds for the metaverse and being able to have KOL engagements, but I do think that those who are willing and interested in taking that jump, I think it will create a really good or a strong memory or experience for their key opinion leaders, something that is really unmatched. I think all of us remember the first time we put our headset on and met in spatial or work rooms. And especially for a remote company like ours, where we don't have the opportunity to, walk by each other at our desk and really have that environment in virtual reality, I think creates an unmatched experience that once we start to have with a lot of key opinion leaders and other pharma companies, I think that really is going to create a lot of adoption in the future too.
We're getting toward the end of the podcast. We have 1 minute left. So beyond the metaverse, since you already made that important comment about it, but outside of it, any other takeaway, Lynn, that you would like to leave for our audience regarding KOL identification, tracking, medical affairs, and all of the topics we discussed today? Any takeaway you want them to remember from today? They had to remember one thing from today's podcast.
Yes. So especially in the last few years, we've all seen that acceleration of digital engagement. So the one thing that I want to leave all our listeners with is really true omni-channel engagement, being able to integrate, orchestrate, and tailor your customer interactions across multiple channels to ensure that they really do meet what your HCP or KOL's specific needs are. I think that's going to be a really important strategy for pharma companies to focus on. But we've definitely been hearing that a lot. How can we make sure that we're increasing ROI and leading to improved engagement and enhanced customer experience?
Lynn, thank you very much for being a guest today. Goodbye. Au revoir.
Thank you. Au revoir.